Waya san gobe ban da Allah in ko ka sani mu ganka. Waya san gobe ban da Allah.
My name is Mohammed Bukar, a professor of obstetrics and gynecology with University of Maiduguri, and a honorary consultant obstetrician and gynecologist with University of Maiduguri Teaching Hospital.
Garo ta London ya zo gida zauna ya yi gida da moto sannan ya samu aiki malam akwai a tashi wani ticen ku bai da keke to mai yasa hakan nan.
The title of my lecture is Usefulness of Sliding Organ Sign in Obstetrics. After the introduction, we look at the usefulness of sliding organ sign in obstetrics and round up with the take-home message. The learning objectives are to appreciate the clinical usefulness of sliding organ sign and to apply the knowledge of sliding organ sign into our day-to-day clinical practice. All images for this presentation were of patients managed in 2 hospitals in Maiduguri, Borno State. The selected uses of sliding organ sign in obstetrics are in cesarean section and preterm contractions. Sliding organ sign is well established in gynecology, but not so in obstetric practice, especially in the 3rd trimester of pregnancy. We all know that more than 90% of women who undergo surgery will develop one form of adhesion or the other. So if these adhesions are detected preoperatively, we would enhance planning for subsequent surgery and patient counseling. There are various preoperative adhesion prediction methods, ranging from analysis of patient characteristics and appearance of the scar, to strike gravidarum severity, uterine thickness on ultrasound, and intraoperative peritoneal adhesion index. But the real-time dynamic sliding sign is cheap, easy to learn, non-invasive, and well tolerated. From our study, we showed that the duration of the sliding sign was 7.56 plus or minus 2.86 seconds. So it doesn't significantly add to the duration of ultrasound scan. The study revealed that fewer than 10% of surgeons inform patients about adhesions as a potential risk of surgery. But when the sliding sign is universally adapted, it may encourage surgeons to inform patients on not only the risks of adhesions, but how to prevent adhesions at surgery. We know these statistics very well. That in the last 10 years, the rate of CS has increased in the United States by 50%. And currently, the average cesarean section rate is 32% in the United States and 40.5% in China. We know the complications associated with repeat cesarean section, from hysterectomy to infection, from hemorrhage to bowel and bladder injury. We all know that with increasing number of cesarean sections, there is delay in delivery. With increasing lower 5-minute Apgar score, increasing risk of lacerations, and increasing risk of birth injury. So all these perinatal adverse outcomes and the maternal morbidity will be reduced if sliding sign is used in patients with previous cesarean section to detect adhesions before surgery. Why is it important to use the sliding organ sign? It will aid the surgeon to plan and prepare better for the surgery. It also allows allocation of more complicated surgeries to experienced surgeon. In cases of prematurity, it allows in utero transfer after administration of steroids, and you can put in measures to prolong the pregnancy. This was the first paper published in the White Journal in 2018 that looked at this novel technique of sliding sign in 3rd trimester sonographic evaluation of intra-abdominal adhesions in women undergoing repeat cesarean section. The conclusion from this study was that a simple sonographic sign might be able to discriminate between high and low risk of intra-abdominal adhesions in patients with a history of cesarean delivery. This technique may aid clinical decisions in patients undergoing repeat cesarean section. In the same year, Drucker et al. Also published this paper titled Sliding Sign for Intra-Abdominal Adhesion Prediction Before Repeat Cesarean Delivery, and concluded that a negative sliding sign predicts severe intra-abdominal adhesions encountered during repeat cesarean delivery, longer time for delivery, and a higher chance of bleeding. This first paper in Asia was titled Predicting Intra-Abdominal Adhesions for Repeat Cesarean Delivery with the Ultrasound Sliding Sign. And the conclusion from this study was that the sliding sign was less predictive than desired for clinical use, and it only detected half of women with dense uterine abdominal adhesions. Furthermore, a moderately low kappa coefficient indicates a lack of reproducibility, further emphasizing the sign's limited clinical value. This was a paper, the first in Africa, that looked at the preoperative sonography prediction of intra-abdominal adhesions using sliding sign at repeat cesarean section. And we concluded that this study supports the role of transabdominal sliding sign in preoperative prediction of intra-abdominal adhesions in women with previous cesarean section without significant increase in sonography duration. This information can encourage planning for CS by ensuring that surgeons of appropriate seniority are deployed to undertake anticipated complex operations. It is a transabdominal approach that is used to determine the presence or absence of sliding sign after previous cesarean section. Any of this orientation can be used for transvaginal ultrasound scan in detected cervical sliding sign in cases of preterm contractions. This is a case of a positive uterine sliding sign. It was a singleton pregnancy in the third trimester with no previous scar. So here you see the anterior abdominal wall, the uterine wall, that's the myometrium, is the placenta. You can see the myometrium sliding freely underneath the peritoneum. This is positive uterine sliding sign. This was at 36 weeks with no previous scar, carrying a twin pregnancy. This uterine wall is the anterior abdominal wall. Note the sliding of the uterus underneath the peritoneum. Free movement of the uterus under the peritoneum. So this is positive uterine sliding sign. There was a multipara attempt with 3 previous cesarean section, again with a positive uterine sliding sign. You see the myometrium here sliding freely underneath the peritoneum. This is a positive sliding sign in a patient with 3 previous cesarean section. There was a patient at 33 weeks with 1 previous cesarean section, again with a positive uterine sliding sign. You can see the uterus sliding freely underneath the peritoneum. So a positive uterine sliding sign. This was a multipara at 21 weeks with 3 previous cesarean section. Look at the boil with shadowing, placenta, myometrium. You can see that there is no sliding at all. There is no movement at all. Trying to see if you can demonstrate any movement by going a little higher. No, there is no sliding. So this is negative sliding sign, suggestive of severe adhesions. If you look at somewhere here, you realize that the myometrium is actually tethered to the anterior abdominal wall. Because look at how thin the anterior abdominal wall is here. Look at how thin the anterior abdominal wall is here. Look at the myometrium here. So this indicates severe adhesions. This was a 29-year-old gravid with 3 previous cesarean sections, but she was in the first trimester with 3 pregnancy. and ovarian hepatocytosis syndrome. Here you can see the ascites, you can see the clear ascitic fluid here. You can see the abdominal wall here. You can see the myometrium here. There is no sliding at all, even at this gestational age. You can't demonstrate any sliding. So this suggests severe adhesions in these patients who had 3 previous cesarean section. So a negative uterine sliding sign. So what is the implication of a negative uterine sliding sign? We know that the sliding sign is negative, and so we plan in such a manner that we reduce the risk of bladder and bowel injury, the risk of hemorrhage, infection, and hysterectomy. Because we also know that there will be delay in delivery of the baby with the attendant perinatal adverse outcomes. We prepare for that and reduce this because we now know that the patient has negative sliding sign, which suggests that we are likely to encounter severe adhesions. The anesthesis, we prepare for a longer duration of surgery, and additional units of blood will be saved because the risk of hemorrhage is increased because preoperatively we detected that these patients have severe adhesions. Either there is the need to involve other members of the MTD that can be done, and this is also important when counseling the patients. This was a paper that was published in 2019 titled Cervical Sliding Sign, New Sonography Marker to Predict Impending Preterm Delivery in Women with Uterine Contractions. Here you look at patients who have cervical length less than 10 millimeters. The positive sliding sign is found in all cases, with cervical length between 10 to 20 millimeters, or up to 50% of patients had a positive cervical sign, but with the cervical length greater than 20 millimeters, less than 10, had a positive cervical sliding sign. Here they looked at a group of patients who had positive cervical sliding sign or presence of cervical sliding sign, and they found out that delivery within 7 days was higher among women who had cervical sliding sign than those who do not have cervical sliding sign. And the conclusion from the paper was that the cervical sliding sign may improve the prediction of impending delivery in women with preterm uterine contractions, particularly in those with cervical length of 10 to 20 millimeters. This was a 26-year-old who had 2 previous pregnancies spontaneously terminated at 4 and 7 months. You can see the cervix is curved, and the curved cervix is a long cervix. The curved cervix is a normal cervix. Here you can see a patient who had recurrent miscarriages, cervical length 18.8 millimeters. You can see the straight cervix. A straight cervix is a short cervix. Look at the open internal os. These were 2 patients, both at 36 weeks of gestation. This was singleton pregnancy, and this was twin pregnancy. So you can see the process of shortening has already started. This was a 20-year-old at 36 weeks of gestation with no cervical sliding sign. So you can see the prop in the anterior fornix. The anterior lip of the cervix is not sliding over the posterior lip of the cervix. So there is no cervical sliding sign in this case. The anterior lip of the cervix is not sliding over the posterior lip of the cervix. So no cervical sliding sign in this case. This was at 30 weeks of gestation with 1 previous preterm birth. Cervical length was 2.7 centimeters. Here we can see the fetal head, bladder, anterior lip of the cervix, posterior of the cervix, external os, cervical canal, internal os, cervical mucosa. So let's look at this. You can see that the anterior lip of the cervix is not sliding over the posterior lip of the cervix. So there is no cervical sliding sign.
yayi gida da da moto sannan ya samu aiki malam akwan a tashi.
This was twin pregnancy at 36 weeks, demonstrating positive cervical sliding sign. You can see the anterior of the cervix sliding over the posterior of the cervix. Also note the recoil of the anterior lip of the cervix over the posterior lip after sliding. So this is positive cervical sliding sign. This was a 25-year-old gravid 7 para 4 plus 2, only one alive, seen at 2 weeks, with 3 previous preterm births, all at 7 months. So, note the anterior of the cervix sliding over the posterior lip, and note the presence of sludge here. So, this is cervical sliding sign. So what are the implications? This allows for proper counseling, allows for referral to a center that has facilities for neonatal intensive care, and gives opportunity for us to institute measures to prolong the pregnancy and also to plan the delivery. So our take-home message is that addition of sliding sign in women with previous cesarean section and women at risk of preterm delivery could reduce overall morbidity and mortality. Thank you very much.
Mu shuka hairi kan mu shuka sharri bai da magani maganin sharri kaga kar mu yi shi